Hey everyone, I'm Jason Bellet, co-founder and chief business officer at Eko Health, and this is the Eko Frontlines podcast. At Eko, we're building tools to transform how providers detect and monitor heart and lung disease, from primary care to cardiology, and increasingly through telehealth. Today we're zeroing in on one part of that ecosystem, remote care delivery. During the height of COVID, health systems had to move quickly, launching virtual care models that could maintain quality, safety, and access. One of the earliest and most forward-thinking adopters of remote stethoscope technology was Renown Health, serving Nevada, Lake Tahoe, and Northeast California. My guest today is Mitchell Fong, who led that effort as former vice president of virtual care at Renown. Mitchell is now the president of the American College of Healthcare Executives, Nevada chapter, and CEO of Innovize Consulting, where he advises health systems on innovation, operations, and strategy. When Renown began testing remote auscultation tools, they evaluated several options, but ultimately chose Eko Telehealth because of the sound quality, the real-time visual waveforms, and the confidence it gave providers to make decisions remotely. Today we're going to dive into what that journey looked like, what worked, what others can take away from it. And Mitchell, it's so great to have you here, my friend. Thanks for joining us.
It's a pleasure to be on. Thank you for having me, Jason. It's always great to hear from you and love sharing whatever I can for others in similar positions.
It's been many years that we've had an opportunity to work together and get to know each other. And wow, COVID feels like it was yesterday and also like it was 100 years ago at the same time. All right, so let's go back in time a little bit to Renown Health. When you first were involved in the telehealth program, what were sort of the big challenges that you all were trying to solve, and high level, what were the goals of the program?
Well, that's taking me back a long time, Jason, but I appreciate you going down memory lane with me here. I think when I first started with telehealth at Renown didn't have a telehealth program. So I was actually doing my graduate research on the need for telemedicine in rural America to address health equity for access to quality care in a timely fashion and helping to reduce waste across the healthcare ecosystem. So when I thought of that, it was really needed in our system. For Renown Health being the largest system in Northern Nevada, we cover over 100,000 square miles as far as just total territory. But with Nevada as a state, we're seventh largest in size and 48th or across the board in access categories or lower. And so when we thought about telemedicine, it was about how do we build bridges to these communities where we are receiving transfers for patients, but further, how can we get upstream and deliver proactive preventive care or routine care where it's not invasive to their lifestyle? A lot of those patients were farmers or worked in their community, shared cars with family, so getting to their visits in person were very difficult. And of course, if they're not coming to their specialty consults, it makes it very hard to manage that patient effectively. And so we really just needed to rethink about the care continuum and how we can deliver that high quality care, but also do we have the capability to really stretch our arms further than what our walls were at the time? This was pre-pandemic. So for us, it was about finding the right workflow and then finding technology that will allow our providers to feel comfortable and confident that we were delivering that quality care, and then leveraging that technology to do it in a more convenient and timely fashion. So I think from a justification of the value proposition, that's kind of what we were looking at. But we were definitely concerned with overall bandwidth and reliability of technology, as well as that operational efficiency.
So take us back in time to when you were working with your providers to find a remote auscultation, remote stethoscope solution. What was the problem that you all were trying to solve, and what was the process like looking for partners?
Yeah, I think for us, we were pretty early adopters of using a Litman product originally for auscultation. And so our cardiologist had previously been traveling, whether by car or by fixed wing plane, to some of these communities. So very high cost as far as just travel and windshield time for them. And so we were just trying to figure out what's the best way to do this. When we had the Litman technology, it was working well. Our providers were comfortable with it, but they still kind of wanted it to mimic the in-person workflow much more. And so as we were looking at augmenting and upgrading that technology, we found Eko, who was partnering with Litman. So we thought, how wonderful. We have a brand name stethoscope that our providers are already comfortable with, but we have technology coming in as a partner that's going to allow them to take this and use it in a room that they're not physically in. And I think that was really exciting for our providers to be able to have a trusted brand, but a different experience with that. We ended up having multiple different providers come by. We had basically a week of opens testing where in our office we had a handful of different stethoscopes out there to use for Bluetooth. We put them in the providers into a certain room and had them test which stethoscope they liked more. We did that as part of our selection process while we were going through our review or for vendors. And what we came out with was that Eko was the highest scoring one from our providers. And from a technology standpoint, our technical team was also very comfortable with the product and the security, and we were excited about it. As we started using the technology, I think one thing that our providers were really excited about was the ability to see that visual sound wave. I think that was a new experience. And now the technology was not just trying to replicate what would be done if the patient was in my office, but it's enhancing what could be done from that experience. And that, I think, was something that was really exciting. And our providers were really interested in using that technology. As we thought about rolling it out to non-specialty appointments as well, we started thinking about, can we store and forward these sound waves and potentially eliminate an unnecessary referral or get a quick second check from a specialist that can just very easily take the recording in 1 or 2 minutes as they have time, asynchronously reply and provide their thoughts. I think those things really enhance our ability to collaborate and remove unnecessary referrals, which we know in our community we had long waits for some of those specialties. So for all of those reasons combined, I think we were really excited about the Eko stethoscope solution.
You mentioned going beyond video only. And so much of telehealth is obviously the video conference, but the ability to hear heart and lung sounds remotely can unlock new use cases and workflows. Can you just share a little more around the impact that high quality auscultation has on telemedicine delivery and confidence?
Well, first and foremost, I'll double click on what you said and say quality is the most important part of care. It doesn't matter if it's more efficient, so to speak, to be seen virtually. If you can't get the right level of care, then you're getting an underservice, and that's not appropriate for clinical care. So first and foremost, it was about making sure we had the clinical quality and the efficacy to be able to support the technology and the solution. I think that really gave our providers the right confidence that this is a care model that I can support. But furthermore, this is a care model that allows me to use the full scope of my license. I think that's where, when I really think back on some of the challenges with the change management, I believe that providers felt like technology was limiting their ability to deliver care at the top of their license. And that's not what they wanted to do. And that's not what they believed patients deserve, which I absolutely align with. And so it was critical that we had high quality auscultation for them to feel like they're able to replicate that level of quality and then be able to make a justified clinical decision on next steps and action. I think that then in turn gives the providers the confidence with the technology, but also with the clinic that they're running, that they're able to deliver the care that they're proud of. So for those reasons, I think it really helps. But then when we go further into the workflow, the ease of using the Eko solution from a single dashboard from a provider that might be connecting with 8 different rural sites throughout the day, instead of having to log off and log into their site, or at that time we're using hardwired carts, so dialing directly to the cart. Those are just things that a provider doesn't need to know or remember to be able to deliver the clinical care. So staying within one dashboard and just clicking on one site versus the next site for the next visit, it really streamlined the provider experience and simplified it. So for us on the technical support side, we're getting much better consistency from our providers and better feedback because we're not having challenges with connectivity and logging in, logging out. And so I think just the workflow resolution was really good. I'll say one other area that really stood out for our providers was using the technology in low bandwidth areas. So we were connected with all the prisons across the state of Nevada and delivering specialty care. We were very concerned with the broadband at some of those locations. And so the ability to actually use the technology with the storm forward and live streaming capacity successfully in those areas, I think was surprising for our providers. And it was a huge boost to our desire and what led to a larger expansion into the rural communities to deliver more service there.
For a telehealth director or leader watching this, there's so many different models of care delivery. Can you just paint a little bit of a picture of what it looked like on the remote or telepresenter side and what it looked like on the consultant or receiving end of the telemedicine visit in terms of the hub and spoke model?
Yeah, I think for us is pretty straightforward, and that's what we tried to make it. So on the provider side, instead of going into your exam room and seeing the patient there, they're going into their virtual exam room, which most of them were using their provider office. They're just jumping on, usually put on a headset, so it's private, and they're in a very similar conference call as we are today. Except for they have their EHR up on one screen, they have their auscultation tools and other tools that they need for telemedicine on another screen while they're watching the patient there, and they're interacting with the patient and a presenter on that side from the rural clinic. On the clinic side, we have presenters. Typically, they were medical assistants that were trained up through our internal program for presentation through telemedicine on all the different tools and the workflow. They would room the patient just like a normal patient, take the vitals, send them to the provider through the EHR and communication, and then they would essentially assist with some of these vitals that typically the provider would put their hands on the patient and do. The medical assistants or presenters, as we call them, would go ahead and do those tasks. So for the stethoscope, for example, they would place it on the different areas, hold it for a few seconds, and then they would look for provider response before moving to the next. So the provider could say thumbs up, which would mean move to placement number 2. They might say hold to keep it there so they can listen longer, but they're just kind of using visual cues with their hands so that they can still listen, but also communicate with the presenter. We use different papers or forms of the body that would also allow the provider to kind of point and click or choose the location on the body to place it just in case they needed further support there. But those were kind of the ways that they were communicating. And so with that, the presenter would be logged into the presenter portal, presenting the patient. It'll stream in. The provider has their own login. So it's a similar platform, but from a different login user access. And then that provider would see all the different locations that they have access to. They'll see the live one that's being used now. They'll ensure it's the right appointment for them, do the appropriate patient verification checks, of course. But then they would be able to get in and see the visual sound waves as well as listen to those. They could store and mark different things there. So that was helpful. If they needed to download or take that and add it to the medical record, they could.
What were the specialties or service lines that were most helped or advanced by having a higher quality stethoscope?
Our highest used specialties were cardiology and pulmonology for sure. But as we think of primary care and urgent care, those are ones where absolutely we can see that need. I think just for us in telemedicine and programs we were doing, we were much more focused on specialty care for those partner communities and supporting the primary care physicians in those rural communities. So we were delivering more specialty care focused on cardiology and pulmonology for us primarily.
Where do you see a solution like Eko Telehealth fitting into the future of kind of where telemedicine is heading? And, you know, if you want to prognosticate even beyond that, where do you think we're heading over the next couple of years?
I think I'll go back to where we started with the icebreaker. I'll say the two words AI and precision medicine, I think are huge. And telehealth plays a huge factor within enabling both of those things. I think when we think about the goal, it's precision medicine to me and how we use data to really drive optimal outcomes that are person-centric. I think telehealth comes into play in understanding what's the capacity of care that we can deliver outside of the hospital walls And how do we leverage those tools in both preventive and proactive fashion when we, when we just need to manage ourselves, or if we're not sure, where should I go? Is something happening? Can I get that treated remotely? Do I need to come in? And I think as we see the evolution with AI and with logistics, when we think about home labs, home testing, pharmacy deliveries, etc., we're really thinking about how do we deliver precision medicine, but also how do we shift that care to the non-traditional environment, to home, to on the road, etc. And I think when we think of telehealth, that's going to be a huge factor in creating the right experience to have the levers to both triage, but also to treat. And I think that's where we think of telehealth adding value. And so a tool like Eko that can come in, add AI, provide more evaluation, support the clinicians, and be able to hopefully streamline that triage process and determination of the next steps for that plan of care, that's going to be huge. And I think as we see all of those elements evolve, we're really going to be looking at how do we truly get to a place of delivering the right care at the right time in the right place. And hybrid care is the standard. So there won't be a virtual first, a telemedicine, a brick and mortar type of solution. It'll truly be about what's the right care that you need and how do we deliver that in a high quality, cost effective manner to use the technology. But then further with the data and telehealth, how do we validate that things are working well instead of waiting too long where maybe things are off track and you have to be hospitalized? We can get upstream and say, hey, things aren't going the way that we expected. Can we do some other interventions that are less invasive to try to correct this before it gets so bad that we might need to rehospitalize you? So when I think of where it's going, I hope that gives a little glimpse into my vision, but I think telehealth is an enabler of AI and precision medicine to really get us to where we need to be.
Absolutely. Well, Mitchell, I could listen to you talk about the future of telemedicine for the rest of the afternoon. And I may give you a call after to keep doing that. But I do want to just thank you for coming on the podcast. We appreciate all of your insights. You're always so clear and offer some really unique perspective on where the industry is going. And for anyone listening, you can always learn more about Eko Telehealth and our full suite of cardiac and pulmonary tools on our website at ekohealth.com. That's EKO health.com. Thanks again, Mitchell.
Thank you, Jason. It was a pleasure.